All right, we are here in Studio B here at News 6. I'm Justin Warmoth, and I'm joined by Dr. Jean Moorjani.
Hello.
Say that right?
Yes.
I said that correctly.
Yep.
First task. And we're talking about hurricane preparedness today. In fact, we have a phone bank going on. You can see the lovely folks behind us. It's happening live right now. The number is 888-436-6665 to get your questions answered. But I have some questions for Dr. Moorjani about kids and how parents should react to them and a whole lot of stuff here. So let's first off by saying, as the storm is approaching and as it's impacting Central Florida,
Yes.
what should parents tell their kids and how should they go about explaining what is happening outside?
Definitely. And I think parents should tailor it based on the child's age. A great place to start is asking their kids, well, what do you know? What have you heard about it? Because they may have heard about it from friends, and you want to get an idea of what they already know, and you want to tell them the truth, but just exactly what they need to know, because they will definitely sense if you're nervous, but they do need to be informed, and that will help them feel a little bit more prepared and a little bit more secure as well.
What about kids with maybe some special needs?
Sure.
Can you explain what they should do with that?
Sure. So any parents of or families of children that have special medical needs definitely want to take an extra step of preparation and making sure they have all the supplies they need. So that means any children that have medications, you know, make sure everybody has enough medication. You know, definitely go to the pharmacy, get refills. You want to make sure you have at least a 2-week supply on hand, because we don't know what kind of damage a storm will do, and if you'll be able to get to the pharmacy. Is the pharmacy going to be open after the storm hits? So we want to make sure that everybody has all the medication they need, and other children may need special kinds of diets or formulas. You want to make sure you have all of that in stock. So just kind of restocking everyone's medical supplies.
And of course, the prescription stuff does not just have to happen for the kids. That is something that adults and whoever is prescribed, they need to make sure that they are prepared. I mean, that's I give the silver lining of having a hurricane approaching. You are well prepared and you are well informed that this is coming. This is nothing that's a surprise, like an earthquake for that matter. So it's something that you should just need. That's part of the list, a checkoff list, right?
Definitely.
Okay, got it. Another question I have for you, and we got this question a lot last year as we were. Matthew was coming through. I answered the phones for quite some time, and a lot of folks were saying, hey, you know, what do I do if I have an emergency myself? Maybe it's not related to the storm. Maybe I'm having a medical emergency. And they're saying that no traffic is allowed to go in and out of where I live. What would be the protocol for that, and if there's anything that emergency officials can do?
Sure. I think that each family, just as you guys keep us well informed, just really understand, like, if you are in an area that needs to evacuate, definitely evacuate and get out of wherever you need to be. I know sometimes people may be like, oh, I'm not really sure, is it really going to hit us? But if you're in an area that is under a warning and we are being advised to evacuate and to get out, I think that it's just best to be one step ahead and be prepared.
Let's turn it over now to pregnant women and babies. So if a storm is approaching and it may be flirting with a due date,
Sure.
what would you tell a mother who's pregnant, and how should they go about doing it? Would they go to the hospital early, or what would you think?
I think a lot of it will depend on how far along the mom is and just the general health of her pregnancy. I think the best thing, as you already said, we're going to know when a hurricane is coming. So I think the best idea for a pregnant woman is to talk to her doctor, and her OBGYN should be able to guide her best for that. Okay. In regards to babies, you want to make sure that we also want to make sure babies have enough food, depending on when the hurricane comes or what kind of damage it's going to do. If moms are breastfeeding, that's great, because then moms and babies can stay together. If babies are formula feeding, we also want to make sure those families know that to have enough food for the babies and enough water as well.
And let's talk about the patients that might be housed at a hospital. Is there anything in particular that they need to worry about, or if they're being housed? I mean, I'm sure it's a safe building, but what would you say to those folks?
Sure. So if you happen to be in the hospital during the hurricane, I would say you're kind of in a safe place.
Not a bad area.
No, there are worse places to be.
Right.
I think it's actually one of the safest places to be. So if you are in the hospital, just talk to your doctor, and you will continue to receive care, and you just kind of stay put.
Were you working around the same time as Matthew hit last year?
So yes, we were working.
You were there? So anything in particular stick out to you, maybe that should have been done, or that you guys have learned from as we move forward to this hurricane season? What kind of learning moments did you guys have?
I think for Hurricane Matthew, as you know, that we where the hospital was, we kind of stayed out of its path
Right.
at that time. So, but we felt prepared and we felt okay during that situation, and I feel confident that we'll be prepared.
Because I know it made that last minute switch. It changed
Correct, yes.
trajectory, and as it was bearing down on us, even 24 hours out, a lot of folks were, especially here in the Orlando area, were saying, "Hey, this is going to be an impact to us." What was the level of concern on from the official standpoint at the hospital and the preparedness level that they were going through?
In terms of the hospital and staff that are working there, I think all of us that were working, we were just prepared from a physicians and nurses standpoint to stay. We knew that we may not be able to get in or get out, so we just kind of had some extra things with us and prepared to stay on if we couldn't get out. So
You guys are in the know.
Yeah.
I mean, you know this state. You're very aware that June 1st marks hurricane season, and we live in Florida. Obviously, a very prone state to this.
Correct.
So you guys are prepared, and you can be prepared at home. Again, we have this great phone bank going on right now. A lot of experts here to answer your calls from everything from construction to, we got ServPro here, we got electricians here, correct? Strata, from the Orange County Emergency Management Office Special Needs Program, Ace Hardware. So we have a plethora of options. If you've never been in Central Florida, if you just moved here, never been through a hurricane, this would be the place to call. So the number, again, 888-436-6665. Thank you so much for being here, Doctor. Very valuable information. Justin Warmoth here. We're going to sign off. We'll be back with much more here on clickorlando.com. Have a good one.